back to Motherhood Journey with Esther, and today we'll be discussing about family planning. Family planning is the ability of individual or couples to attain their desired number of children and spacing and the time of their birth. So today I'll be sharing 10 family planning methods that you can employ. The first one is birth control pills. These pills has a hormone that stops ovulation, because without ovulation you can't get pregnant. This pill's effectiveness is 99.7% effective. These pills you have to take daily. So check this picture. This is how the pills look like. If you skip a dose, immediately you remember. As soon as you remember, use it. If you skip more than 2 doses, continue with the other dose every day, but make sure you use a backup method. A backup method can be spermicide or usage of condom. The second one is emergency contraceptives. Just like its name implies, that is, maybe you have sex without using any contraceptives like condom or anything, you are not protected. You can take this emergency contraceptives as early as some people call it next day drug. You can take it the next morning when you have sex, up to like 3 to 5 days that you have sex and you don't want to get pregnant. So that is why it is termed emergency contraceptives. The third one is patches and ring. The ring is inserted into the vagina. This ring, it will be inserted for 3 weeks. Then you remove it the 4th week, whereby you can have your menses. The patches can be placed on your belly, buttock, upper arm, or back. This patches also helps to prevent pregnancy. You use it for 3 weeks, then you wait for 1 week, then you continue to use it again. Then every patches, you change patches every week. It is 98% effective. The next one, which is the number 4, is birth control shots, or you call it injectables. It contains hormones that hinder you from menstruating or ovulating. Depo-Provera. This, you take the injection every 3 months interval. This prevents pregnancy, and it is 99.8% effective. The 5th one is birth control implants, or you call it implanol. This looks like a mattress. It's as long as a mattress. It's not as thick as the wooden of the mattress, but it looks like a mattress. This is implanted at your arm here, under your skin. Only you can feel it, no one else can see it. So the midwife, doctor, can help you put it under your forearm skin. See the picture here? Yeah, the picture is there. So it is implanted, and then there's 2 types. There's one implanter which is okay for 3 years. You will use it for 3 years before removing. You can remove it anytime you feel like removing it, but it's effective for 3 years. And the second one is Jadel. That one is as effective for 5 years. That is, you don't need to use, it's not a drug you use every day or injectables. When you put it there, it is there until it's expired. Like I said, the implanter expires 3 years, while the Jadel expires after 5 years. You remove it, then you put another one in place in case you don't want to get pregnant. This implanter is 99.9% effective. The 6th one is IUDs, small letter S. It is called intrauterine device. Some people call it copper T or coil. So this copper T is inserted through the vagina into the uterus, into the womb. This helps to prevent the sperm from fertilizing the egg, which leads to pregnancy. And there are two types of copper T. There's one that is a copper device, which is a copper T, and there's another one which is hormonal. Oh, this is the picture, you can also see it there. So this IUC is 99.2% effective. I hope you understand and you are already planning on the family planning you'll be using after that, your baby. So let's move to the next point. The next one is vagina contraception or spermicide. This spermicide repels or kills sperm. This comes as insertion into the vagina, pyrosex, and this repels sperm by creating an inhospitable environment for sperm. Thereby, there will not be fertilization. It comes as foam, jelly, tablet, cream, suppository, or dissolvable film. So it is 70 to 80% effective. The next one is the barrier method. The barrier method is the condom or the diaphragm. There are two different types of condom, the female condom and the male condom. The condoms or the diaphragm serve as physical blockage of sperm. Like you can collect the sperm into them and can be disposed. So effectiveness is 98%. In real life, condom is like 85% effective because it's liable to wear and tear, or when it's not being used properly. Next one is fertility awareness based method, which is also known as the natural method. This is when you track your menstruation and ovulation, checking your vital signs, especially your temperature, and tracking cervical mucus. This will help you to know when you are ovulating, thereby to abstain from sex to prevent unwanted pregnancy. And this is limited because not everyone has a regular cycle. This can only work for those that have a regular cycle, and it is 76% effective. The last method is permanent contraception, known as sterilization, called vasectomy or tubal ligation. Vasectomy is for the male, while the tubal ligation is for the female. Vasectomy is where a surgery is a minor surgery that is being performed in the male sexual organs to prevent the sperm from entering the semen. It doesn't mean that when they have sex, it's not going to ejaculate, but there will not be sperm in his semen. And after this vasectomy, they will keep testing for sperm in the semen of that man for at least 3 months before there will not be sperm in the man's semen anymore. Then the man is totally sterile forever, and it is a permanent family planning. While for the female is called tubal ligation. Tubal ligation, this is a blockage of tube or tying of the tube, which prevents egg from entering into the uterus and preventing fertilization, which hence prevents pregnancy. So this is also a long life family planning, and this is a minor surgery that the person can go home that same day when the surgery is performed for man and for woman, and then the person can have sex, unprotected sex, without getting scared of getting pregnant. It's a permanent family planning. So I would quickly classify all the family planning I've talked about into 3 phases. We have one, the natural method, which is the one I call fertility awareness. That one is the natural method where you check your temperature, your cervical mucus, and so. Then the progestin pills that you take every day, which is hormonal. It is hormonal. So I'm talking about the hormonal now. The pills are hormonal. The injectables, they are hormonal. Copper T, I said there is hormonal and there is the one that is not hormonal. So copper T has an hormonal. Then the ring and the patches is also hormonal. Then the implantor is hormonal too. So when we talk about device, copper T we go for device, and then when we talk for device, copper T and condom, diaphragm, sponge, we go for device. And why spermicide, we will see the gel spermicide, the tablets, suppository spermicide, and those ones, they are the one that kills sperm and prevent the sperm from entering into the uterus. Lastly, I will talk about a common family planning, which is also known as lactational amenorrhea. Not every woman experiences this. Lactational amenorrhea is when you are breastfeeding, doing exclusive breastfeeding for 6 months. Then you would not see your menses, thereby you are not ovulating, so you won't get pregnant. But immediately you start introducing family food, family diet to the baby, then you are accompanying it with maybe usage of condom or some other family planning of your choice. The family planning that is 100% sure is abstinence. Abstinence is so effective, and you won't even contact any sexually transmitted infection or diseases. I hope you have learned 1 or 2 things today from this video. If you have, don't forget to give this video a thumbs up, and if you have watched to this moment, you are just coming to this channel, kindly subscribe to this channel. Don't forget to invite friends to this channel, because on this channel we'll be talking about everything everyday woman: pregnancy, baby, childbirth, preventions of infections, and of girl child. All will be discussed on this channel, and I hope you'll be blessed watching this channel. Don't forget to drop a comment at the comment section. Thank you. Bye.